And welcome back. Well, the pandemic has made visits to the doctor more challenging, but for new parents, it's important for newborns to get a proper checkup. So here to help your baby stay healthy is Dr. Arethusa Kirk with United Healthcare. Hi, doctor.
Hi, thank you for having me.
Absolutely. Thanks for joining us. Talk a little bit about why it's so important for parents of newborns to consider still getting their checkups and seeing the doctor.
Certainly, COVID-19 has really impacted well childcare, and it's very important for children of all ages to go in for their in-person well child checks. But those children that are infants, especially those between 0 and 2 years of life, have a number of important milestones in terms of their development as well as their immunization schedule that makes it very important for them to get those well child visits. So just here to encourage families to reach out to your family practice provider or pediatrician and get those in-person well child visits scheduled.
That's right, because you got to have them planned out because, like you said, they need a specific schedule as well. So, when you're talking about children's wellness visits, a lot of things that you stress to parents is preparation and that being key. So what do parents need to keep in mind when they're prepping for a visit?
Well, there's a couple things I would say that they need to keep in mind. One is everybody has on their mind infection control for COVID-19, and practices do have in place COVID-19 infection control protocols. Generally, they're going to have a screening for COVID-19 symptoms, potentially a temperature check, ask everybody to wear a mask, and have social distancing or physical distancing within the clinic space. Particularly for infants, as we're trying to protect them from infection, there may be specific times of day in which the practice is having the infants come in for their well child checks. But most importantly for families, they have questions about what they want to discuss with their provider. So preparing in advance for those questions is very important. What we've done at uhc.com/children's wellness is help create some of those sample checklists for those families that have infants 0 to 15 months that they can download and use if they prefer.
I think that's super helpful for a lot of new parents because it can be overwhelming, I'm sure, for many. So what can people expect? A new parent who's got a young one, what can they expect at some of the visits, at the appointments, once they physically get there?
Sure. So generally what you're going to expect for any one of those visits is that your pediatrician or family practice provider is going to be reviewing what we call early prevention, screening, diagnosis, and treatment. So the physical exam is designed to determine whether growth and development is going as planned. And that, through the conversation with family and through the interaction with family, we can see in terms of developmental milestones whether those have occurred. In addition, immunizations are one of the most important cornerstones for prevention of communicable diseases and help protect infants from infection. And that occurs during many of the visits during the first 2 years of life. Starting at age 2 months or as early as 6 weeks is the first set of immunizations. I'd just like to also put a plug in that if immunizations are behind, we have a plan for that. CDC has a vaccines catch-up schedule, and we can certainly make sure that children are getting their vaccines in the series that they need to, even if they've gotten behind a little bit.
As we kind of enter into some of the winter months with, colds, flus, with COVID, what can parents be aware of at home for their little ones? What sort of symptoms or things that when they see in their child, they know they should go to the hospital versus treat at home?
Well, I think in terms of that hospital versus treat at home question, there's lots of ways in which you should be interacting with your pediatrician's office or family practice office for advice and for specifically during that specific clinical event. And that's why having a established well child home is so important, so that you have that relationship with your provider. But certainly I would suggest that all children get their immunizations up to date, and that specifically during flu season, we talk about getting the flu vaccine, which can be given as early as 6 months and is actually recommended for 6 months and up.
That's great. You got to protect the little ones. Thanks so much for joining us, Dr. Kirk.
Mm-hmm.
Here's the website.
You're welcome.
For
Thank you.
Yeah, absolutely. It's uhc.com/children's wellness for more.